Hi, I'm here with Daniel Black, a refractive cataract surgeon in private practice as a specialist ophthalmologist at the Sunshine Eye Clinic in Queensland, Australia. So it takes a lot of work today to deliver great results with cataract surgery, but the occasional refractive surprise still occurs. So what I want to know is just how unhappy do patients get when they experience a refractive surprise?
Nobody wants to be disappointed. Patients don't want a disappointing result. Surgeons don't want a disappointing result. Patients will judge the success of their surgery and the ability of their surgeon based on their level of uncorrected visual acuity. So it's imperative that we're obtaining emetropia. And you know, it's all about prevention. It's about careful planning and preparation and using that medical technology to prevent that disappointment in the first place.
And of course, it's very challenging and costly to rectify. What are the consequences when, the rare occurrence does happen, a refractive surprise does occur?
Sure, it is. I mean, patients typically will require some kind of second surgical procedure, which carries with it additional expense and some degree of inherent risk.
And does it become more challenging when toric IOLs are used?
Absolutely. And about half patients presenting for cataract surgery are going to benefit from toric correction. Many of the premium presbyopia correcting lenses mandate probably less than or no more than half a diopter of residual astigmatism in order to get their best results.
So there are a lot of steps in between ocular biometry to the completion of surgery, and many of them are still manual for most cataract surgeons. So what are the points where these errors can start to creep in?
Well, look, it starts in the office with the biometry. If the patient's head is not correctly aligned in the instrument when you're capturing the biometry and the keratometry, you'll get an error. If the patient is trying to accommodate on the target while the keratometry is being taken, there may be some cyclotorsion. So there may be some inherent errors right from the start. Then in the operating room, it's important that the cardinal axes are marked while the patient is sitting upright prior to surgery. Then when the patient comes into the operating theatre and is lying down, the steep axis needs to be marked as well. And so there's potential for errors all along the way.
But I understand you now have the Zeiss Cataract Suite markerless, so which of these steps can you now skip? Well,
look, it's interesting. We were interested because of the efficiencies that this would bring to our practice. We've been able to eliminate the step of marking the patient out in the preoperative area. We've been able to eliminate manually marking the steep axis while the patient is supine prior to surgery. And not only has that brought efficiency, but sometimes we got complications from those steps. We would sometimes get an epithelial defect. On a couple of occasions, we even had some quite spectacular subconjunctival hemorrhages from the marking instrument rupturing a blood vessel.
So how does the Zeiss Cataract Suite markerless technology work?
It works, it starts in the doctor's office when the biometry is captured. At the same time, automatically, the Zeiss IOL master will capture a limbal vessel image. And then when the patient lies supine under the microscope, the limbal image is matched and the keratometry is automatically aligned no matter the degree of cyclotorsion.
So what's it like performing surgery with the Optime Lumera surgical microscope with overlays from Callisto Eye?
It's great. It probably took a few lists to get used to the data injection or the overlay that comes through the microscope, but I'm very, very comfortable with it now. And in many ways, it's just like on a modern flight deck in a commercial airliner. The pilot has a head-up display which overlays information about the aircraft's speed and altitude, and that helps the pilot to fly more safely and more accurately. And so that same sort of technology is now being employed in medicine, and these overlays help us to operate more safely and more accurately.
So you talk about safety more accurately, but what about your patients' outcomes now you've adopted Zeiss Cataract Suite markerless?
Well, that's an interesting question. Our motivation for getting the Cataract Suite was improved efficiency. And in fact, when we first started, I almost wondered whether we should be still putting some manual markings on to check how well it worked. We conducted an audit after our first year of using the markerless suite, and we compared 500 cases that we'd done the old analogue way with the ink mark. And with that, we found that about 94% of our patients were within a half a diopter of residual astigmatism. We then compared that with almost 250 patients who'd been done with the Callisto markerless system, and we found that that number had jumped to 99%. So 99% of our patients now have no more than half a diopter of astigmatism after surgery. And in fact, of those that did have more, they had no more than 3/4 of a diopter. So we've been absolutely astounded by the results.
Has Zeiss Cataract Suite markerless changed how you practice cataract surgery?
Yes, it has. Because we have much greater consistency, we're in a better position to offer patients presbyopia correcting lenses, premium lenses, which mandate low residual astigmatism and low residual refractive error in order to be able to get the best results from those lenses.
So it's fair to say that you're pleased with your purchase.
Delighted.
Daniel, it's been a pleasure. Many thanks.
Thank you.